The state government has graciously been very supportive of the Delta State Contributory Health Commission, which has been in existence for some years now, and thank God that the present governor has continued with the legacy of the previous government. And I want to say that so far it's been a good experience because we've been able to meet the most of the health needs of most of the people in Delta State, a large number of people in Delta State, because we know that healthcare is not cheap, especially with the current economic downturn. A lot of people cannot really afford healthcare. So for instance, you see a pregnant woman who cannot even eat 3 square meals. You tell her to come and pay 300,000 for CS. She really cannot afford that, but with the help of the state government, Asaba Specialist Hospital has been able to offer free maternal care to her patients. In fact, our delivery rate is about 180 per month, and we do about 60 to 7 cesarean sections every month, free of charge. And a lot of indigent people have actually benefited from this, and it has gone a long way to reduce the death among pregnant women and their children too. So I would say that the state government has indeed done very well, because with the scheme and the support, the drugs and all of the things that go with it, as a hospital we've been able to offer care to our patients as at when they need it, and without them having to worry about the financial aspect of the care that they require. So I want to thank the state government and say we hope that this continues, and the Deltans will definitely be very happy with it if it's something that goes on beyond, as in beyond now. Yeah. Healthcare is not cheap, so we attend to, in this hospital, we attend to over 10,000 patients most months, and that's quite a lot of patients, yeah. For the pregnant women who all access free care, we see over 3,000 of them every month, both outpatients and inpatients, minus the children less than 5 years who are also under the scheme. So it has, the contribution, so that means that our bill to the commission is actually very high. Yeah, so what they do is they pay us from time to time, and usually it comes in bulk. So, you know, normally patients come every day, they pay small, you know, your money is building. But when contributory health pays us, the advantage is that we can actually use it to do something capital for the hospital. So you see things like the endoscopy machine that we've bought. It also helped us to buy our X-ray machine. It helped us to do some expansion in the hospital. Indeed, it has do accreditations, which cost a lot of money. So because you cannot really get that money in bulk from a day-to-day business that you are running, because patients don't pay in bulk like that. So, but with the Contributory Health Commission, it has really helped us to do a lot in terms of developing the hospital. So it's like a win-win situation. So we have some patients who pay every day, and then the commission that pays maybe once in a few months, you know, and that has really been useful to us in terms of developing the hospital. Well, I know that the premium for contributory health in a year in the informal sector is 7,000 naira. It's little money. So I know if somebody has malaria and has chest infection, you are certainly going to spend more than 7,000 naira. So just imagine your family and all of that, the amount of money you will spend if you are paying out of pocket compared to if you just pay 7,000 naira for you. So I think it's something that people really need to be advised. They really need to key in and assess the care that is being offered by the hospitals and by the state government, because healthcare, like I said, is not cheap. So I want to use this medium to advise those who have not keyed in to please do so, because with a little amount of money, you're able to access a very broad range of services that otherwise you would have spent a lot of money on. So I know that there are a lot of Deltans who are not civil servants, because for civil servants, you are enrolled in the scheme as a civil servant, so you are keyed in. But for people in informal sector, in private sector, you know, they are not really part of this. Most of them are not part of the scheme, except those who pay that premium, or if they are less than child less than 5 years, or a pregnant woman. So for those other set of people, I really want to encourage them to key in, because it's really good. It helps you to save money, and then nobody budgets for sickness. So when a sudden illness befalls an individual, you know, you have a health insurance backup to fall back on. So I think that everyone should be encouraged to get themselves registered and access the care.